I want to formally kick off session 2 of Good Dog's 4th annual health symposium. So, in case you missed it, we kicked off our symposium officially last week with a presentation by Dr. Carla Barstow. It was absolutely amazing. We cannot wait to have her back at the end of the month. And in case you missed the recording of that, that's live on this Facebook feed. We can drop a link to that in the chat for anyone who missed Breeding Healthy Dogs Part 1. And like I said, last week, this is truly one of the highlights of our year. We love putting on this health symposium as a way to give back to our community and really bring you these opportunities to get such incredible insights for your programs from leading canine health experts. So we can really raise the bar on our programs and ultimately have a healthier future for all of our dogs. So to continue this month-long event, we have Dr. Fran Smith joining us again. We absolutely have loved having her on for many talks throughout the year, and today she's going to be presenting on neonatal and infant health, birth to 6 weeks. I did hear from one of our breeders that we should clarify that this is about puppies, because maybe some people were confused. So we are going to be talking about puppies today. If you were coming to talk about human babies, I'm sorry if you're going to be a little disappointed. But in part 1 of this 2-part discussion, Dr. Smith is going to be sharing how to assess newborn puppies for viability and growth, and how to support weak puppies. And then we're also going to discuss recommended supplies and materials, as well as tail docking and dewclaw removal, which I know is always a really popular topic among our community, and you're always eager to learn more about that. So that's what we're going to focus on today. And like I said, you can find a recording of session 1 from last week's presentation with Dr. Barstow, Breeding Healthy Dogs Part 1, on this feed, and we can drop a link to that as well. So everyone has that. And I want to just extend a big thank you to our friends at Purina Pro Plan for sponsoring this event and helping to bring it to life to our community. During the Q&A segment of this presentation, we got a lot of previously submitted questions, so we're going to prioritize those first. But please use the chat, as I see many people already are, to ask any questions throughout the presentation, and we'll do our best to answer those as well. And then last housekeeping thing I want to mention, I know I previewed this last week, but this year we're posting quizzes after each session. They're really short, and you can take it to test your knowledge from what you've learned. And if you complete all 4 of the quizzes by the end of our symposium at the end of October, you're automatically eligible to win prizes from our partners like Purina, Snuggle Puppy, Revival, and more. And then we'll announce those winners at the end of the month. So we will post quiz 1 for anyone who might have missed it and joined last week's presentation and wants to test their knowledge. And then quiz 2 will be shared later on in our private group and in our newsletter as well, so you won't miss it. So definitely keep an eye out for that and complete it. And I want to share a little more about Good Dog for anyone who is new here. I see we have a ton of people joining, and I'm guessing some of you might be so unfamiliar with who Good Dog is and what we do. Good Dog is on a mission to build a better world for our dogs and the people who love them by advocating for responsible dog breeders like yourselves, educating the public, and promoting canine health and responsible dog ownership. We're a secure online community that's created just for dog breeders to connect with serious, quality Good Dog applicants and find forever homes for your puppies. I know we have a bunch of people in the chat right now who said they just welcomed home a litter of puppies. We use the power of technology to help good breeders level up their breeding programs by providing them with tools like our payment system to protect them from scams, our software to post available litters and connect with Good Dog applicants from all across the country, as well as a number of free educational resources like this, health-related discounts, and more to just help your breeding programs thrive and give you that well-deserved time back to be with your puppies and not have to worry so much about all of the other aspects of running a breeding program, which I know can be extremely time-consuming and stressful. So if you're not yet a member of our community, we invite you to learn more at gooddog.com/join. We just dropped a link in the chat to that as well, so you can do that. And I really quickly, and then I'll stop talking, just want to share a little bit more about Dr. Smith and her amazing background. Dr. Smith became a diplomat of the College of Theriogenology in 1986. Since that time, she has been in private practice as a small animal practitioner, specializing in canine reproduction, so no one better to have here today than her. Dr. Smith is one of very few board-certified theriogenologists in private practice. Her expertise in genetic counseling, chilled and frozen semen, and reproductive infertility of male and female canines is known throughout the United States. Dr. Smith frequently speaks to breed groups, veterinary associations, and students, and the general public. Dr. Smith retired from full-time practice in March of 2023, but maintains licenses in Minnesota, Mississippi, and Colorado. And Dr. Smith grew up in a military family that bred German Shepherd dogs. I think we have some German Shepherd breeders here. Her commitment to veterinary medicine began at 7 years of age and was confirmed in her high school yearbook, which stated that her goal was the patter of 40 little feet, not human. So with that, I'll pass things over to you, Dr. Smith, to get our presentation started.
Thank you, and good morning, good afternoon, or good midday, wherever you all are. So this is a very interesting topic, and I'm glad Nicole pointed out we probably should have put neonatal health in canines birth to 6 weeks. But that is actually what this talk is about, and we're not going to talk about human babies, although I happen to really enjoy babies as well. My grandchildren are now all grown up. Second, okay. So as Nicole said, I'm a veterinarian. I have a PhD. When you graduate from the University of Minnesota, you get a PhD and it says Doctor of Philosophy. I will tell you, I am not a trained philosopher, but I have lots of personal philosophy. I am a diplomate of the American College of Theriogenology, which is the reproduction specialty. It's comparative, meaning all species. And it is a combination of human, OBGYN, and urology. So that's my specialty. I'm the president of the OFA, the Canine Health Information System, which is the world's largest animal health database. I'm the president of the Labrador Retriever Club Incorporated and the health chairperson for the club, which means when oddball diseases happen or when someone has a Labrador with a problem, they tend to contact the club and the question gets passed on to me, and many times I can help them. And I'm a dog breeder of Labrador Retrievers under the registered kennel name Danik, which is a combination of my 2 children's names, Dana and Nick. I also am a licensed AKC hunt test and field trial judge, and I judge lots of confirmation specialty sweepstakes at shows around the U.S. So what do you need to know to have healthy puppies? When does neonatal health begin? Well, it actually starts way before you're talking about this mama dog and being pregnant. It starts with how do you select the dam of the litter. And I would tell you in your breeding programs, one of the things that you should consider is the fertility history of the particular female that you're going to keep back. And as an example of that, I would not keep a female who had a litter of, here we're going to talk about a medium to large size breed, who has litters of 2 to 3 puppies, particularly if her mother does that in a breed like a Labrador or a Golden, where the normal reproduction and litter size is around 7 puppies. Likewise, I would not select, if I really want to breed dogs, a female who only cycles once a year. Normal cycling interval in a female is between 4.5 and 7 months, except in the Basenji breed, which naturally only cycles once a year. It also is influenced by the sire selection. You want to select the female puppy that you're going to grow up for your next brood female from a male that is able to provide lots of health, temperament, and looks in all of his puppies. And so the point here is that factors associated with health are influenced prior to conception. For dam selection, other issues, the female should be mature enough to have all recommended health testing for her breed, or in the case of designer breeds, all of the contributing breeds. For Golden Doodles, and in Minnesota, I had a Golden Doodle breeder who did a spectacular job, and she did all of the tests that were necessary for both Goldens and for Poodles. And so that would be OFA hip, OFA elbow, OFA eye, a cardiac exam, the PRCD form of PRA, and patellar luxation. Now, of all of those tests that I talked to you about there, only one of them is actually a DNA test, meaning you can get that on your cheek swab. I think there's a lot of confusion about the fact that you can send in a DNA panel and it will test for all of the diseases that we have a genetic test for, but it is incapable of doing all of these other things. It can't evaluate hips, elbows, eyes. It can't evaluate the heart, and it certainly can't check for luxating patellas. The female should be 2 years of age. Bitches younger or older have increased incidence of health issues associated with reproduction. And that includes poor mothering, more inertia, smaller litter size, etc. Additionally, females over age 6 have decreased litter size because a puppy is born, her ovaries contain every egg that she will ever ovulate. And as she ages and as she has cycles, more and more eggs die off before she is even ever bred. Additionally, to have a really healthy litter, you want a minimum health database. And that includes a screening test for liver and kidney disease. In that panel, we'll look at things such as alk phosphatase, and we'll also look at BUN and creatinine. A hematocrit tells us how many red cells she has as a portion of her blood picture. Varicella canis testing are both vital. Parasite control is also vital, and that is because we're going to talk about 2 parasites specifically that the puppies can be easily infected with. The first one is Toxoplasma canis, the canine roundworm. Actually, if a female has roundworm, they will insist in muscle, and they're activated in the last third of pregnancy when they migrate through the placenta. But Toxoplasma canis is also transmitted transmammally in mother's milk. Hookworm, or Ancylostoma caninum, is also transplacentally transmitted, but it does not have any transmammary infection. Heartworm preventative should be continued throughout pregnancy and has been proven to be very safe. External parasites should also be controlled, but you need to read your labels carefully to be sure that they are products that are safe during pregnancy. I do not recommend tick collars during pregnancy at all, because the ingredients are very variable. And also, tick collars have their own set of risks unless a female is maintained on her own in case another one in her group gets the collar off and eats it. So there are 3 products that are known to be safe in pregnant animals to control fleas and ticks are Revolution, Frontline Plus, and Bravecto. Do not use products containing carbaryl, which is a great insecticide because it may cause brachynaphia, which means short jaw, taillessness, extra toes, failure of parts of the skeleton to form, and dystocia, which is difficult delivery. Carbaryl can actually cause uterine inertia. So I have a list here of drugs that are also known to cause congenital defects or be embryotoxic. Embryotoxic means the embryo oftentimes is killed in utero before it is ever born. Congenital, the puppy is, we assume, is born live or dead and has problems with it. Altrenogest is a progestational agent used to maintain pregnancy in dogs. Aspirin, ciprofloxacin, corticosteroids, DES, a female hormone, doxycycline, enrofloxacin, estradiol cypionate, excess vitamin A, excess vitamin D, gold, griseofulvin, misoprostol, that's a drug that is oftentimes used to cause abortion. oxytetracycline, pentobarbital, stanozol. That's a male hormone used for bodybuilders and to be strong and give you lots of body mass, testosterone, tetracycline, and warfarin. So we have lots of drugs, and there are drug formularies that will tell you whether these drugs are safe or not, and they are listed from A through D as far as the effects on pregnancy. A means it is known that they have no effects on pregnancy or embryos. B, they're probably safe. C, use them if you need to, but if you can avoid them, don't give drugs. And D, known to be dangerous to pregnancies and fetuses. Topical products can also be problematic. And I want to stress to you that just because you only put a product on an animal and not in an animal, meaning you're not feeding it to them or forcing them to consume it, there still are effects. Many of these products are absorbed through the skin or the mucous membranes. And again, we talked about carbaryl, which is an insecticide. Dexsodium phosphate ophthalmic is used in lots of breeds of dogs that have eye issues. The next two, Genesis topical spray and Momedamax, they're used primarily for dogs with allergy. Momedamax is a fabulous product that is used to treat ear infection. Any other eye medication that contains a steroid should be used very cautiously. Panalog cream, which has steroid in it. Pennyroyal, both Pennyroyal shampoo and any other Pennyroyal topicals. Rotenone, St. John's wort, and Tri-Top. So avoid steroids. Be very, 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 very careful. So the female should also be current on her vaccinations and or have titers performed to assess for antibodies. You need to have current vaccinations to maintain maternal antibody levels. I know that there are a lot of vaccines which are advertised to last for 3 years. That may or may not be true in the environment in which this female lives. And if you want your puppies to have the maximum amount of protection that they can get from their mother, I recommend that you vaccinate all of your females annually. You're going to see a picture pretty quickly here about why this is so important. The bitch has what is called an endothelial chorial placenta. So the puppies get the immunity that they're going to get from their mother in the first ingestion of colostrum. And puppies that get normal amounts of colostrum will have antibody levels of approximately 95% of the dam's antibody level. So that's good and it's bad. And in a week when we talk about what I call vaccinology, we'll talk a lot about how that affects when and how often you should vaccinate your puppies. So this is the endothelial chorial placenta. So in the center here, we have this puppy with an umbilical cord. The placenta is donary. And with a wide strip around the middle, that's how the placenta attaches in the uterus of the female. And so the fetus then absorbs all of its nutrients and all of the outside products, the products that the mom needs to take away, are all transferred through that placental attachment, and it is zonary. But it basically prevents the transfer of antibodies through the placenta. There are other species of animals where when the placenta is different, that the baby gets almost all of the antibodies through the placenta, but not so in the dog. And the neonate gut, which is the baby's intestine, it starts to decrease 8 hours after birth and is no longer possible 48 to 72 hours after birth. So what that means is, if the newborn puppy does not get colostrum after 72 hours, it's too late to provide colostrum and have any antibody response to that. And the antibody response that you get to colostrum is called passive immunity. So the puppy itself is not creating the immunity. It comes directly from the mom itself. Another important issue to realize is sometimes maybe you've had a C-section and your mom is not the greatest mother. You want to still get a little bit, and it doesn't take much colostrum for those puppies before you give any formula. Like bottle or tube feeding of formula prior to them getting colostrum causes the gut to change so that it can't absorb those antibodies, which results in puppies that may be able to be infected with bad diseases as early as 4 weeks of age. Another, I think, important part, they do lots of great advertising on this. Goat milk is great. It's very healthy, but there is no advantage to any goat milk puppy formula over any other commercial formula. Neither goat milk or cow's milk are similar to the milk that the female dog produces. Proper nutrition for the mama dog begins before she's bred. And I can't stress strongly enough how you need to read the labels on your dog food bag. The labels will tell you what stage of life that food is intended for. And if it says maintenance, which most foods say maintenance, that food is not designed for reproducing females. So proper nutrition involves feeding a quality name brand diet labeled as complete for all life stages by the Association of American Feed Control Officials using feeding trials. ProPlan is what I feed all of my dogs. It is an all life stage food and it is labeled just this way. The food should also state that it is suitable for pregnant and lactating animals. So the take-home message here is no maintenance foods. Now, let's say our mama dog has had 2 litters in a row and you're going to rest her a cycle, meaning she's not going to be rebred for close to a year. You can feed a maintenance food during that time period, but start well before her next expected heat with an all life stages food. So the mama dog should be kept fit. Her caloric intake needs to increase, allowing a weight she delivers. So that's a big change in weight. Now, the female's fat, she doesn't need to gain that much. If she's thin, she may need to gain more than that. And if you think about it, in nature, nature's going to take care of mama, because if there's no mama, there are no babies. So in the case of poor nutrition, some of those embryos and fetuses may die and may be resorbed, decreasing your litter size. Remember also, as the uterus expands, there's not much room in there for a stomach full of food. So she might need multiple small meals during the day to make sure she's gaining it properly. We now know a lot about maternal and fetal gene expression, and we now know that good nutrition can influence the metabolic state of an animal for its entire life. What that means then is if a female is grossly underfed or undernourished, even though she gets calories, they're not good calories, it's going to affect her puppy's life for their entire life. So pregnancy diagnosis. It is very important after you have bred your females that you diagnose whether they are or are not pregnant. And this is not a failure to conceive lecture, but it's really important that you confirm pregnancy 25 to 30 days after the first breeding. If you have a relaxed female and she's not too fat and she's smaller, you can feel swellings in what you assume to be the uterus 23 to 30 days after breeding, which is 25 to 30 days after the LH surge. After day 30, you cannot palpate the uterus because the fetuses within the uterus are large enough that the uterus is like one big tube and you can't tell if there are swellings there or not. Ultrasound is the method of choice for pregnancy diagnosis. And particularly, we talked about the fact it's important to know whether your females are pregnant or not, because if you're worried about infertility, the workup, the diagnostic protocol to determine why they're not pregnant relies on knowing whether they became pregnant and didn't maintain their pregnancy, or whether they were never pregnant in the first place. So ultrasound is actually useful at 25 days after the LH peak with really good new ultrasound machines and an experienced ultrasound technician. You can see as early as 21 days. At my practice in Minnesota with our really, really good new machine, we could see 21-day fetuses. And by 25-day fetuses, we could actually see puppies swallow and yawn. It's pretty phenomenal. And you certainly can see heartbeats at that age. The ultrasound does allow you to differentiate pregnancy from the fluid-filled sacs in the uterus. Oftentimes I would ask the client, how do you know they were pregnant? They said, well, I could feel them. Yes, you could feel the swellings, but without ultrasound, you don't know that that was a puppy. Radiology is the technique of choice to determine litter size. And it may underestimate very large litters, like over 8 puppies, or in the case of something like a Yorkie, even if there's 5 puppies, it gets pretty crowded in there. It wouldn't be hard to tell how many there are. Can be performed after 45 days, but the closer you are till time of delivery, it will be more and more accurate. In some cases, radiology will also allow you to tell that you have a dead puppy because you will sometimes have gas in the uterus. Just to alleviate your fears, today's X-ray equipment will not cause any kind of damage to the fetus from any radiation. There are also hormone tests that can be done. A hormone test, relaxin, is a hormone produced by the fetal placental unit, and it's pregnancy specific. The best way to measure that is by radioimmunoassay or by enzyme-linked immunoabsorbent assays called an ELISA. There is a bedside, dog-side, in-clinic test that has been developed for relaxin, but it is not as accurate as ultrasonography. I have seen females with big litters where it says they are not pregnant, and females that end up not producing a litter where it says they are. So it's a tool, but it's not exact. The other hormone that you can measure is progesterone, but progesterone rises and stays high in females that are both pregnant and not pregnant. So it really cannot be used to diagnose pregnancy. So we're going to talk a lot now about birth defects. A birth defect is a deviation from normal morphology, eyes, ears, feet, et cetera, or a function that occurs during pregnancy. There are 3 critical periods in fetal development: pre-implantation, that's fertilization to implantation. So once the egg is ovulated, it travels through the fallopian tube, ends up down in the uterus, where actually it does quite a bit of moving around and can actually move from one horn to the other. Implantation does not occur until 18 days, approximately day 18. So it's hard to assess, and plus tiny. And so ultrasound does not work prior to implantation. The embryonic period is when all of the organs develop, and that's when many birth defects occur. The last period is the fetal period. Growth and maturation of organs occur, and that's where we see some of the things like cleft palates and some other skeletal or oral defects occur. Most serious birth defects, again, occur during that middle period. During the fetal stage, that's when you have problems with the palate, the cerebellum, which is parts of the brain, parts of the heart, and the urinary tract system. And just for your own information, in humans, 60% of the birth defects, meaning congenital malformations that our babies are born with, have no identifiable cause. However, in dogs and in people too, some defects are caused by single gene mutations. Other causes of birth defects are maternal illness or viruses, pollutants, heavy metals, toxins, and drugs. Just for those of you who like to do supplements, excess vitamin A and excess vitamin D, or for that matter, any excess of a fat-soluble vitamin can result in problems in puppies. With health testing, you can avoid many of these deleterious outcomes as long as we have a DNA test for the defect. And an example of that would be the PRCD form of PRA. We know that that is caused by a single gene. So if a puppy gets 2 copies of that gene, ultimately it will have PRA, which affects its vision, okay? There is no test for, let's see, cardiomyopathy or hip dysplasia. Those are phenotypic tests, but health testing can help you a lot. And that's where I said when you do the panels, that will only detect diseases that we have a known gene association. The most common defects that you see in puppies are cleft palates, atresia ani, which means the puppy is born without a rectal opening, abdominal clefts like hernias, and skull defects. Again, I want to stress to you that because a disease is present at birth, which is congenital, it may or may not be hereditary. And I want to use cleft palate as an example here, because if a female dog, female is treated with an ear medication that contains one of the strong steroids, that can result in cleft palates in the offspring. That is not a hereditary defect. However, in some breeds of dogs, like many of the brachycephalic, we have hereditary cleft palate. A clue that may help you with that, because there's no direct test at this point for cleft palates, is when you're deciding who to keep again, look at the ridges in the puppy's mouth, the roof of the mouth. There is an association. Now, that's not cause and effect, but there is an association if the ridges don't line up directly with producing more cleft palates. Remember, I'm telling you it's an association. It's not cause and effect. So that might influence which puppy in the litter you're going to keep to hold back for further breeding. Make sure that you pick each puppy up every day to see if there is any dorsoventral flattening. So a normal puppy's chest is somewhat V-shaped. So when you put your hands around it, your hands should naturally come together. With some puppies, you will have puppies that at what's called the costiochondral junction, which is where 2 parts of the ribs come together, they will get very flat and they start to look like pancakes. If you identify that early and learn how to do the physical therapy, those puppies can be completely turned around and will be completely normal. If they are extremely flat and you do not discover and treat it, typically those puppies will get into severe breathing difficulties by 3 to 4 weeks and are likely to die. So this is an example of a congenital defect. I apologize for the picture. This is actually from a textbook that I had a chapter in, and this was a picture I took. I can't find the original picture, but this is a miniature bulldog, and it has what is called fetal anasarca. So this puppy has a very abnormal jaw and head. If you look at his legs here, they're really shiny, and he feels squishy when you touch him. There's tremendous amount of fluid that is retained under the skin, etc. And oftentimes these puppies are born alive, but they also often have heart defects associated with this. This appears to be, based on breeding studies, a recessively inherited trait. So what does that mean? If you have a litter that has an Anasarcus puppy, and I will also tell you these puppies greater than 99.9% die. If you have a female that produces a puppy like this, it doesn't necessarily mean that you need to discard her as a breeding animal, but you certainly should not repeat the breeding. Pick a different stud dog. Likewise, I would say if you have a male that is producing, that you're getting lots of Anasarcus puppies, I would replace him with a different male. Because males, just because of their ability to have such an influence on numbers of dogs, can be far more detrimental in your breeding program than the female is. This is another common defect. This happened to be a Maltese puppy, and that is a complete cleft. You can see to the left of the screen that puppy's nostril, and the entire roof of that puppy's mouth is open. Not only can he not get any suction to nurse, but if he does nurse, milk is going to run out his nose and into his lungs. Clefts are not always this big. Sometimes they are very tiny, and you can have a pinpoint cleft anywhere in the palate that is difficult to see. So a puppy that fails to grow or has a hard time nursing, I would look very carefully at the palate to see if you can find the cleft. Puppies can also have a cleft lip where the palate is completely normal, but the lip is split. And while that's cosmetic, if the palate is okay, from a clinical standpoint, they do well, and cleft lips are quite simple to repair when the puppy is old enough to have surgery. Cleft palate puppies are a real challenge to raise, and my personal recommendation is to consider euthanasia. If they do survive to the age where surgery can be done, it typically requires multiple surgeries to repair the defect. So the puppy is in for a long haul and a lot of expense with not a very good prognosis. So here's an example of some other defects. This is another puppy with a cleft, and that one is even wider, way at the base of the tongue. This is a kitten that was born without a piece of eyelid. And this is a puppy, the C is a puppy that was born with a defect in the closure over the spine. So there's another skeletal defect. So these are all congenital. Looking at these pictures, we cannot say if they are hereditary or not. Some breeds of dogs are predisposed to them. All of the brachycephalic dogs are predisposed to fetal anasarca, and I showed you the picture of that puppy. The syndrome appears to be a recessive, and there's no genetic test to screen for the carrier stage. So now we're going to talk about vaginal discharge, because we have to get these puppies out alive in order to get them to 6 weeks. Normal vaginal discharge is mucoid and pretty minimal in most females. Hemorrhagic or bloody discharge is abnormal. Green tinged discharge is abnormal, and black discharge is definitely abnormal. So let's talk about stages of labor and risks of labor. During stage 1 labor with uterine inertia, what can happen? You can have the collapse of the female. If you have a female that's vomiting during labor, I would get on the phone to my veterinarian so that I'm sure I can have help if I need it. During stage 2, if you have straining for 30 minutes without any results, again, talk to your veterinarian. 3 hours with intermittent, just weak contractions before the first puppy, and more than 3 hours between puppies. I would also tell you that I am very reluctant to have clients give oxytocin during stage 3 labor or stage 2 labor, because these females are already trying. And nature has a way of trying to protect that mama. Again, she has to survive for her puppies. Having performed hundreds and hundreds of C-sections, I can tell you that if a female starts labor and stops and doesn't want to strain, oftentimes that female has what I like to call a traffic jam. You may have 2 puppies trying to be born at the same time, one coming down each horn. They meet and nobody will fit. If you give oxytocin in a situation like that, you can actually rupture the uterus. Also, more than 3 hours between puppies indicates that you've got problems. Which reminds me that one of the reasons you want to radiograph your females to know how many puppies is so that you know when they're done, but also because singleton litters oftentimes result in uterine inertia or dystocia. One of the things that triggers labor in the female is release of the hormone cortisol, which comes from the puppy's adrenal gland. And that is produced when they're around the time when they're ready to be born due to crowding. So if you have a Labrador with 1 puppy, there's not going to be any crowding, which means there's not going to be much cortisol, and you may end up with a dystocia and needing a C-section. So whelping, you should provide a whelping box with high sides to prevent drafts. Commercial whelping boxes or plastic swimming pools are okay. If your female is basically your pet who has always slept on your bed and always been part of the family, and you now want her to be in a whelping box to have her puppies, you're in for a bit of a battle unless you start this early, because she's going to feel rejected. You should prepare, so get her used to the box early, make it a really pleasant place to be, and decide where you want that whelping box. Prepare the tools to assist with delivery. You want absorbent bending, no shavings, clean towels, bulb syringe, hemostat, scissors, dental floss, and tamed iodine or silver nitrate stick. So this is an example. This is one of my own females. As you can see, this is a DuraWhelp whelping box. I don't work for DuraWhelp. Many other companies make them. It has a nice rail. The advantage of the rail is that if a puppy gets behind her, she can't lean with the rail. It prevents her from squishing the puppy. Also, you will see above her, that is a poultry light used for baby chicks to provide heat. The guard prevents the mom from being burnt. And because it is actually, you can't see the pin around this, I hang this on a chain that I can lower and raise it to make sure the temperature in the whelping box is good. These are also, can't think of the company that makes them, but it's an absorbent pad design for whelping boxes. They also make them in white. I like them in plaid because they don't look as dirty all the time. But this is a really, really nice setup for whelping for the female. It gives her enough room to lay all the way on her side so the puppies can nurse. And this is another example. This is a wading pool, which works. Towels is bedding, and this also at this point would have a heating pad, a heat lamp above it. Here's another example, and you can see the wading pool. This is normal, immediate post-whelping discharge. I know that looks messy, but those puppies just finished being born. And as the mom gets up, she's gonna drip all this greenish black goop, and that's okay because all of the placentas are now detached and all of the puppies are born. Approximately half of puppies are born rear legs first. People say, and people call me, it's a breech birth. That is not so. A breech birth means the rear end is presented first, not the rear feet. And if the rear feet are coming, it's really not more difficult for a female to have that puppy than if it is head first. All right, for resuscitation of the puppies, the big thing you want to do is get the membranes away from the puppy's head. First-time moms often are a little stunned, particularly the ones that are family pets primarily. They don't know what that thing is and where it came from. Break the sac right away. Stimulate the puppy to breathe by rubbing it, or you can grab it slightly by the scruff of the neck, and the puppy should be pink and vigorous. It's doing well. Don't worry about the afterbirth. Way too many people get all panicky about removing the placenta and cutting the cord. There's actually a fair amount of blood in the placenta, and you can leave that cord attached to the puppy with the placenta for quite a period of time. And by quite a period of time, I'm not talking about days, but if they had to stay on for an hour, it would be no big deal. If the mama is cutting the umbilical cords, look at the cords carefully. Some moms are really good about crushing the cord as they cut it, and others don't. And puppies can lose a lot of blood from the umbilical cord if the cord has not been crushed. If necessary, clamp and cut the cord. If you have to cut it, I would cauterize it, and that would be with the tamed iodine or silver nitrate sticks. Remove the placenta. You can let the bitch eat the placentas if you choose to. Realize if she were delivering in the wild, she probably would not leave her puppies for several days, so that would be her food source. If you do let them eat all the placentas, you are almost certain to have her develop nasty black-green diarrhea about 48 hours later. That doesn't mean she's sick, that's just really a rich diet. So check the puppy for a normal palate and the normal rear end and for any other unusual findings. The puppy needs oxygen, and I cannot stress that enough. You've got to get those membranes off the head and have the puppy start to gasp. You can hold them head down. Many puppies are born deficient on oxygen due to the long labor, long delivery, uterine crowding, placental detachment, and maternal shock. The important thing is get this puppy breathing. The first few days, be sure the puppy gets colostrum within 8 hours of birth. If their mother doesn't have any colostrum, or for some reason that it's not available, you can use maternal serum, but it's a more complicated process. You should weigh your puppies at birth and at least every 24 hours. In contrast to babies who almost always lose weight and it's considered fine, puppies should really not lose weight. They can lose a little bit, but if they lose more than 10% of their birth weight and you don't intervene, they're almost certain to die. Normal weight gain is 1 gram per pound of anticipated adult weight. So a Labrador puppy that you expect to weigh 60 pounds as an adult should gain 2 ounces a day. So let's say I've got a litter and all of the puppies were born at 14 to 16 ounces. And a couple of the 14 ounces are not gaining very much. They're gaining 1/2 to 1 ounce a day. What should you do? You want to start your supplemental feeding right away. Don't take them away from the mother if they can nurse, but supplement them preferably with a bottle. And we'll talk about bottle versus that. So what do puppies need? They need heat, humidity, and oxygen. The average newborn puppy will only thermoregulate to 7 to 11 degrees above ambient temperature. So to put that in perspective, if your house today is at 80 degrees, or in my house today, my house is at 74, and I have the puppy laying on a towel in 74-degree temperature. That means the maximum body temperature that puppy will have is 85. And at that stage, its gut will not work and it will die. The first week of life, the puppy should be in an environment where right under the heat source, or however you're warming them, it's 88 to 90 degrees with about 40 to 60% humidity. All puppies benefit from oxygen-rich environment after birth. So some of you, I'm sure, have heard about supplementing oxygen right away. I would encourage you not to use welder's oxygen. In most states, you can't buy medical grade oxygen without a veterinary license or some type of prescription. But there is an alternative to that, and we will show you. So again, my puppy's not gaining, start supplementing 1 or 2 times a day with a formula that will meet the metabolic needs of the puppy. Look for the word maltodextrin in the formula. It has been demonstrated in multiple facilities that formulas with maltodextrin in them, the puppies gain better than if it is not in it. Again, allow the puppy to nurse by add bottles or tube feeding. When do you start? Once the puppy starts gaining normally, you can stop the supplemental feeding. Another important thing for you to know is that the same number of calories by bottle or tube, the bottle-fed puppy will gain significantly more weight than will the tube-fed puppy, as the suckling action itself stimulates the brain and the intestine to work better. The puppy must be warm before you start supplemental feeding, or it will suffer gut stasis, meaning the gut won't work. The milk, in essence, will rot in there, and they will develop gas, and again, that can be fatal. Remember, the puppies can't thermoregulate, so they need warm environments to develop. I will also warn you, don't have it too hot. If the puppies are crying with their mouths open in a panting-like motion, they are too hot. And you can kill puppies with too much heat too, because they don't have enough tolerance and liquid to be able to withstand dehydration. Remember too, if you're taking care of orphan puppies or a poor mom, they cannot urinate or defecate until about 14 days of age. When you stimulate the puppies to urinate, you should look at the color of the urine. Normal puppy urine in a puppy that is well hydrated, the urine will be almost clear. If the urine is yellow, the puppy is dehydrated. So now our whelping complications. When do you know you're in trouble? If you have a prolonged gestation, greater than 71 days after breeding, greater than 65 days after the LH peak, or greater than 57 to 58 days after diastasis. I will also tell you an easy clue is the temperature will drop to below 99. And if your mama dog doesn't start labor within 24 hours, you should be contacting your veterinarian. Recommended equipment: hand towels, a hemostatic Kelly, a scissors, tamed iodine, silver nitrate, dental floss or suture material. In our clinic, we use suture material. At home, I really like dental floss because it's actually easier to tie. And then bulb, syringe, or other suction. Here's an example, and this is a big curved hemostat. And you can see that picture, and I have it on there because we're going to talk about tail docks and dewclaws. And I like a big curved hemostat to be used in that process. And then these are just iris scissors that I use for dewclaws after they're clamped. This is some examples of some feeding supplies. This is a bottle with a bent neck. I don't think you can buy these bottles anymore. Our practice bought cases and cases of them, but they prevent the puppy from gulping a lot of air and getting bloated. And again, you want the bottle on the the bottle attached to the nipple such that there's just enough pressure that it almost grips at the connection. So the puppy doesn't have to work too hard and the nipple does not collapse. This is a puppy feeder that's developed by the people who make puppy warmer with special nipples. It's great. And obviously these are tubes with various sizes of nipples. If a puppy doesn't respond to your stimulation when you're rubbing, you can use the Jen Chung acupuncture site, which is called GB26. So you actually take a 25 gauge needle just below where the nose leather joins the skin and put that 25 gauge needle in and you rotate it clockwise. It works for a lot of puppies, but not all. Look again for cleft palates. If when you're delivering a litter, you have one with a defect, concentrate on the ones that don't have defects. And again, be sure you get all of the mucus and stuff out of the airway. Now, if the puppy's being born and it comes out wiggling and screaming, you don't have to do any of that. You can give the mom time to crush the cord and lick the puppy and get it moving on. But if nothing is happening, it's your job as the owner to get in there and get the puppy breathing. Temperature regulation, remember, it can't generate much heat. Week 1, you want the environment 86 to 90 degrees. So right under the heat lamp, if you're using a heat lamp, 86 to 90. Week 2, 80 to 85. After week 4, around 70. I don't recommend heating pads because it's very difficult to control. You can easily burn them. And if the heating pad is large enough, puppies will move towards heat if they're cold and away from heat if they're hot, but they can't if the pad is big. And I talked to you about the poultry brooder light with 125 watt bulb. So I'm going to talk to you about the puppy warmer, which has been really a game changer for me personally at home, and as well as in our clinic. We had several of these. It's an enclosed chamber that looks much like an aquarium that allows control of heat and humidity. When you use it with an oxygen concentrator, it serves as an actual incubator. You can use this and it greatly increases puppy survival. So this is what it looks like. The heating mechanism is up here. This is a reflective, it looks like rubber, but it reflects the puppies and helps to control the heat. And this is what the oxygen concentrator does. You hook tubes up to this, there's water in this chamber, and it humidifies the air in there with the puppies. I recommend during a normal delivery, after the first puppy or two is born, putting all the puppies in the puppy warmer, let them get a really good boost of oxygen, and you will be amazed at how much stronger and more vigorous your puppies are. Certainly C-section puppies, we always use them. And remember again that their puppies are hypothermic when their body temperature is below 96. So if you don't keep them warm enough, that's a real reason for death. Again, they can't digest food when their body temperature is too low. If you rewarm them, say you go out, you have your whelping box in a different bedroom and the heat lamp went out and you've got cold puppies, don't hold them right under the heat lamp and try to warm them up real quickly. Warm them very gradually. So surgical procedures. Here we're going to talk about tail docks and dewclaws. You need to know that within each state, there are laws governing surgical procedures that may be done on animals. In general, if you own the animal and it does not constitute cruelty, it is okay for you to do many things on your own animal. However, that does not mean that you can dock tails or dewclaws on your cousins, your kids, your friends, or any other person's puppies. In many states, that is considered non-licensed practice of veterinary medicine, and you can be prosecuted. So if you're going to do this, learn how to do it right. Tail ducts and dewclaws are best removed if you're going to do it from 2 to 5 days of age. If you do it properly, they're quick and they're pretty low levels of pain. To find out how long, there are many, many charts published about length of the tail, but you need to read the charts carefully because some say leave 1/2, others say take 1/3. You want to be sure you're following the directions or you can end up with tails that are too short. When in doubt, not unlike doing construction work, if you leave it too long, you can always make it shorter, but once it's docked, you can't put it back. Among the performance community, particularly among the agility community, many of those people believe that the dog needs its front dewclaws to better compete in agility. I don't know that that is necessarily well documented, but if you have people waiting to get one of your puppies for agility, you might as well just tell them from the beginning that you always do dewclaws. I do get people, I remove dewclaws on my Labrador puppies. I do get people who say, I want you to leave the dewclaws on my puppy. And I said, that's not going to happen because the puppies are 1 day old and I don't know which puppy you're going to get. So I'm not leaving the dewclaws on all the puppies. You should deworm all puppies at 2, 4, and 6 weeks of age, regardless of what your fecal exam shows you. Start offering solids as early as 15 to 18 days, or if the puppies start crawling towards her food. If the mom is on all life stages food, soften her food with warm water or warm formula, and you can use that as a weaning diet. I actually use one of those little blenders that you can use to make smoothies. They're not very expensive and they work great for that. Start puppy stress and social development early. I mean daily. Pick up each puppy, lift it, turn it over. Subject puppies to brief environmental stresses. So take the puppy out of the whelping box, lay it on the ground for 30 seconds. It'll be much colder on the ground. And that's a really good thing for the puppy to experience and recover from. Also make sure that your whelping box materials are non-slip. Eyes should open by 14 days, vision's limited, ears at 5 to 14, and they should walk by 14 days of age. Watch for puppies that are straddle-legged or when they stand up, their legs go straight out to the side or have difficulty get up on their legs. Again, your puppies, even from the time that they should walk, you need to do this carefully, lots of different surfaces and textures. My goal is to have the puppies on 7 different surfaces by the time they go home. Provide toys to grab, bite, that make noise. Provide loud noise and noise from household appliances. I have a robotic vacuum. I like to have the puppies see that and hear it. TVs, radios, etc. I also keep radios in my puppy room all the time, and I change the station. So sometimes we do hard rock, sometimes we do classical. All different types of music and sounds is really good for development. When you're weaning every few days, thicken the formula and offer food that is not softened. They should be removed from their mother at 5 to 6 weeks for the mom's sake, unless they're toy breeds, who oftentimes need more time. And I like to dry my mama dogs up by, my puppies are 5 weeks old and they're eating solid food. It might still be a little bit soft and some dry. I take the mom away totally. For 24 hours, she gets no food and is not allowed to nurse them. She's allowed all the water she wants. The next day, she gets 1/4 of her normal food. Again, all the water she wants, no nursing. Day 3, half her food, no nursing, all the water she wants. And on the 4th day, back to her regular diet. This will allow her to dry up rapidly her underline will get nice and smooth again, and then she can go back and be a mom to the babies. So that covers it. We barely got through it. Next week, we're going to talk about vaccines, vaccinology, and other issues. We have any time for questions, Nicole, or are we out of time?
I think we have time for a few, if that's okay with you.
Absolutely.
Okay, amazing. One of our first questions is, do you believe in using early neurological stimulation, ENS, for puppies? If so, what positive results have you noticed in your litters?
Well, that's kind of what I just talked about. The earlier you do little stressors that they recover from, the earlier that they're on textures, hear noises, etc., you will have puppies that are much more confident and that don't get, quote, freaked out if some odd issue occurs in your household. Yes, it absolutely makes a huge difference.
Amazing. Thank you for summarizing that. Another question we have is, how do I know if a puppy is getting enough colostrum, enough milk, or if the dam's milk supply is sufficient?
Okay, great question. The best way you can tell that colostrum, I like to put each puppy on a nipple separately, watch it suck, realize when they're sucking, their tongue should cup that nipple. And even if it gets colostrum for a few minutes, colostrum is loaded with what the puppy needs. It doesn't have to get much. If it even probably gets a cc, which is about how much is in an injection, that's probably adequate. As far as after that, if the puppy is gaining, like it should, a gram per ounce per pound of adult weight, it's getting enough milk. If it's not, it needs to be supplemented.
Awesome. One more question we have about tips from you. Someone's curious what they should do if the dam does not want to stay with the puppies. Any tips that you have there?
So, how to get the mom to stay with the puppies? The big thing is make sure she's comfortable in the whelping box. If you can, if it's again a female that's always been a pet, sometimes having the whelping box closer to the family will be good. And realize the puppies need to nurse when they're newborns at least every 3 to 4 hours. If she's out of there more than that, it's fine. If it's just, and there are such things as bad mothers, which is hard to fix. But occasionally for females that are like that, a drug called metoclopramide will really help get them to be better mothers because it causes release of the hormone prolactin, which stimulates mothering behavior.
Amazing. Thank you for answering that one. I think we have one more, and tell me if this is something that we'll actually be covering in part 2, because I have a feeling it might be. This person is wondering, do all puppies have worms?
Yes, that's a great question. All puppies do have worms, except in situations where they are born in what is called an SPF facility, that's specific pathogen-free facility. In that case, what they do, they have a special worming protocol for all the pregnant moms throughout their entire pregnancy. They are wormed frequently, and actually they are treated with Revolution, which is selamectin, and then the puppies are delivered by C-section and not allowed to nurse. Those are the only puppies that don't have worms.
Awesome. Thank you so much for answering that. I think that was the last question we have for you. Thank you again, Dr. Smith, for being here for such an amazing presentation. We love having you join us, and we're really excited to have you back for part 2 very soon.
Thank you very much. You all have a wonderful day.
Thank you. And thank you so much to everyone who joined us for session 2 of our month-long symposium. We still have many more exciting events to come, so please stay tuned for those. If you aren't yet a member of our community, you can apply to join at gooddog.com/join, so you could stay up to date on all of our future events. And like I mentioned, you're going to want to head over to our private Facebook group for a discussion of our favorite takeaways from this presentation, and I have a feeling there are a lot that we're going to share. as well as the quiz that we'll be posting right after this, so you can test all of your knowledge from today's webinar. And of course, this was all recorded. It's going to be available immediately on our feed right after our live stream ends, so you can go back and rewatch as many times as you need to, take as many notes as you need to, and we really encourage that. And a little preview of what we're looking forward to next week. We're going to have Dr. Smith back here again to continue this talk with pediatric puppy health, 6 to 12 weeks. And that's going to be on Wednesday, October 16th. So next week at 1 p.m. Eastern, right back here on Facebook Live. And we will drop the link to register for that in case you haven't already. But we are so excited for part 2 of this discussion. But until then, I hope everyone has a fantastic week, and we'll see you back here next week. Thank you, everyone. Bye.